Colorectal cancer is one of the most common causes of cancer death among Hispanics, especially among Puerto Rican Hispanics. Because of that, we wanted to determine what was the prevalence of colonic polyps, specifically adenomas, since it has been not shown before what is the prevalence of adenomas among Hispanic patients, especially from Puerto Rico. We performed a retrospective study that was conducted in a community-based practice where we evaluated Hispanic Puerto Rican men and women that were older or equal than 50 years of age. And they were undergoing their first colorectal cancer screening colonoscopy. We wanted to understand not only what was the prevalence of colonic polyps, adenomas, we also wanted to determine what was the prevalence of advanced lesions and where were they located, whether it was in the right colon or the left colon. We also wanted to determine whether or not age was associated with the prevalence of colorectal adenoma. Using a retrospective review of charts from over 2,000 individuals that were screened, we performed the statistical analysis with approximately over 700 patients that underwent their first screening colonoscopy. Our data is important because it shows for the first time the prevalence of colorectal cancer adenomas among Hispanics from Puerto Rico. We showed that the prevalence overall for any size and type of adenomas was approximately 20% higher among men, that was about 30%, and lower among women, which was approximately 10%. When we look specifically at those polyps that are called advanced adenomas, we realized that that percentage was smaller, was approximately 4%, and that's lower than what has been reported in other populations. A very interesting finding from this study was that we were able to observe that polyps among Hispanics were predominantly located in the right side of the colon, even after adjustment by other confounding factors. This specific finding has not been observed among non-Hispanic whites. However, a similar location of colorectal neoplasia and adenomas have been described previously among Africans and African Americans and blacks in the U.S. Therefore, these findings are interesting because we know that Hispanics are formed out of three main races, that is the European, the Indian, and also the Africans. Therefore, it might be that there are some molecular differences based on the ethnicity, based on the race of the group of Hispanics that you're evaluating. One of the important findings that we also want to highlight is that we did not find a difference between the location of the right side location of the polyps between men and women. That is, both men and women were more likely to have their polyps located in the right side of the colon. This study is important because it shows for the first time in a group of Hispanics from one location, in this case Puerto Rico, the prevalence of colorectal adenomas. The prevalence overall was similar to that reported in non-Hispanic individuals. However, we do notice that the incidence of colorectal neoplasia is higher among non-Hispanic groups compared to Hispanic groups. So we're not quite sure why we saw a similar prevalence of polyps. Nonetheless, we know that there is a lower incidence of colorectal cancer among Hispanics. Could be that there are reasons that are beyond ethnicity and race. Could also be environmental factors that contribute to this. Based on this report, we recommend that Hispanics should continue to undergo colonoscopy starting at age 50, and colonoscopy should be the preferred method compared to sigmoidoscopy due to the fact that the Hispanics were more likely to have polyps located on the right side of the colon.